Hi everybody. On the agenda, I'm Nick and Teresa Chinn. Evidently, I'm only one of those, and hopefully you can work out which. So I'm going to talk to you about something very slightly different, and I'm going to be as quick as I can. I'm even going to start a stopwatch. So there we go. I am about 25% of a team of 1.25 of people that look after quite a large group of tweeting healthcare professionals. I like data, not the ones and the zeros of it, but actually what it drives and what you can get out of it. So I just want to literally in a couple of minutes talk you through about 4 years worth of stuff that we've done, which some of you might know about. I recognise a few faces in the crowd, so that's quite nice. But this is basically the story of one tweeting nurse. So this is Teresa, who is actually nursing at the moment, so that's why she couldn't be here. And about 5 years ago, she came to me and said, I've got a bit of a problem. I don't think I can be a nurse anymore. And two thoughts went through my mind quite quickly. One is, where do I find that salary from if that's your decision? That was the first instant thought that went through my mind. And the second thought was, well, that's a bit of a shame, because the reason she felt that she couldn't be a nurse anymore was that she didn't feel that she had access to the latest practice. She didn't have an opportunity as an agency nurse to spend a lot of time reviewing current practices, and that was just a bit of a shame, really, because she was a pretty passionate nurse, but went into agency nursing to raise the children, which I think is something that quite a few people do. So I said, well, why don't you go and find some people like you and see if you can't connect with them and see if you can't create a group of disconnected nurses. And that happened about 3 or 4 years ago. And to cut a fairly long story short, she started a community of tweeting nurses that met fortnightly on Twitter, had a discussion of an evening, sometimes about something clinical, sometimes about something to do with the workforce. What was quite fascinating was it transpired that it wasn't just the agency nurses that were in this disconnected state. There were quite a few healthcare professionals that felt like that. And what's happened over I can't do two fingers. What happened over the years, over the last few years, is not only was it nurses, it transpired that there were quite a few other healthcare professionals that came along and said, actually, we'd like this big virtual space to chat and discuss. So we opened up the platform that we built for the nurses, and it spread throughout about 14 different communities now. For those that can see, there's a little Australian community that's cropped up recently, and then there's this odd guy at the bottom, this little Twitter icon with a police hat on. So the police have come to us and said, oh, that thing in health you do with connecting people to discuss ideas and learn, could we do that? So the answer was, yeah, of course you can do that. That's fine. So the cops are on their way. When we registered WeCops, I did also register WeRobbers at the same time, just in case somebody else did, in case they were going to come along and do something entertaining. So what we have now is this kind of quite buoyant environment where lots of people are engaging. We're not really very data-driven. We're not really very stats-driven. The ethos very much is if 2 people turn up and learn something, then that's time well spent. But we do have a little bit of data, but this isn't really a data presentation I'm going to talk to you about. We've gamified the process so people get a feeling of where they fit in the community, and we've gamified it to help them drive activity that will benefit them. So we're pushing engagement between people. We're giving people rewards for blogging and sharing and hosting chats and that kind of stuff. So the data in there that we're presenting back is a kind of traditional reward, loyalty, gamified set of data. So you can get your stars for X number of different types of tweets and things. I'm not sure if these slides will build or not. Just in terms of where we are, like I said, about 3 years old. There's 625 topic-based archive tweet chats on the WeCommunities website. So if anybody is looking for something around pressure ulcers, diabetes, do not resuscitate, whether that's from a nurse point of view or a doctor or an ambulance point of view, then there's plenty of discussions on there. We are currently archiving around about somewhere between 7,000 and 10,000 tweets a day from these communities. So there's a database of just under 4.5 million tweets that we're sat on currently. And what's interesting is what we've done with them, because the answer is absolutely nothing. It's sat there and we're waiting to try and find a way to extract some value from that. But because it sounds a bit of an odd thing to say in a kind of let's all value data session today. What we're interested really is in connecting those healthcare professionals. The data that's coming out of the end is a bit of a byproduct. But I just wanted to share one thing that we've done quite recently with you, just to show you the sort of power of connecting these people. Is on Monday we're having our first conference. And for about 2 years we've been trying to not have a conference. Just to put this in perspective, there's no money involved in WeCommunities, so there's no funding. It's something that's done completely in our spare time. There's about 114 volunteers that run these 14 Twitter communities. But everyone said they wanted to have an event, so we said, well, okay, we'll give you a date. The only thing we're going to give you is a date. You, as a community, have got to do everything else. So then we had a chat. What would an event look like? So they defined what they wanted to have in the event. And then money came up. How are we going to fund it? Well, we're going to crowdsource it. Who's the crowd? You're the crowd. So we raised £8,500 via crowdfunding. So that was quite nice. It's almost covered the cost of it, which is great. The next thing we did is we put tickets on sale. So we wanted to cover as much of the cost of the conference as possible with the cost of the crowdfunding, but we wanted to make sure that if someone's committing to come somewhere, then putting a few quid in your pocket is a good way to get these people to come. So it's £5 a ticket. And the reason why I'm going through all of this is that the last thing we did, which only happened on the 12th of January, was we told people what we were going to do on the day. So we managed to create a community that was connected enough to say we want an event. We got them to put it on. We got them to pay for it. We got them to commit to a day off on the 29th of February, the day of the year that no one knows what to do with. And they all committed to that without actually knowing why they were going to drive to Salford on Monday. So that was kind of quite an achievement. Ought to throw some data in a session about data. So the total we are following is around 120,000 people. The hashtag in 2005, the hashtags was used 212,000 times. And if any of you have anything knowledge of social media, you have to have a cat in your presentation. So this is a cat reach. So the total tweet reach in 2015 across all of the We accounts was just over 1 billion. So like I said, there's a lot of information and a lot of data there, but actually what I wanted to come today to talk to you about was really the disconnect between these 120,000 healthcare professionals that have come together in the most positive, constructive way. The way they've dealt with NHS bursaries, the way they've dealt with junior doctor issues is really positive, really constructive. They are amazing at coming up with solutions, finding each other, and it connects people. So one of the things that interests me in my day job, I work with data. I work primarily with health data within a small company that works with a lot of local authority data. And the oddest thing is the technology that we're using. Okay, it's up to date because it has to be secure. It's sensitive data. You know, it's right up to date technology. But actually, what we're using it for is really very, very simple. We're joining police data. We're joining social care data. We're pinpointing the 10 or the 20 or the 30 families within a local authority that needs the most help. And it just seems so very, very simple. Yet here we are having to have a day where we're exploring good uses of data, when for many of us it just seems so obvious. So I live in this sort of dichotomy of a world where I have this window into 120,000 really positive and really constructive healthcare professionals, but in my day job I work with quite a different set of people who don't seem to see the value of data, despite the fact that most of their practice is evidence-based. There is this great big gap between using data to get to where we need to go. So it's been great to come down here and kind of share this social media world of people sharing and connecting via Twitter. But really, it's this dichotomy that I have. So I kind of wanted to end with posing a question rather than ask if there's any questions, and that is in terms of how do we break away, and I think it was touched on earlier, how do we break away on this disconnect from data being scary, being maths being poorly presented, and actually make, whether it is citizens or whether it's counsellors or whether it's healthcare professionals, just think about using data in a slightly smarter way. Still went over, but hopefully by not too much.